Thank you, Chris. And thank you to everyone watching from what I hope is the comfiest, coziest corner in your virtual workspace. My name is Manda Klein, and I have the honor to serve on the board of Texans Care for Children since 2019. A few weeks ago marks the 1-year anniversary of Texans Care for Children's last luncheon event. And I remember it because it was the last time I actually traveled, and it was the first time attending as a board member. I remember sharing hand sanitizer with other attendees and smiling as I literally rubbed elbows with a lot of you that are probably watching today. I remember it because only a few days later, at least for me, it felt like the start of the pandemic was here in Texas. And I also remember it fondly because we were honoring a good friend of ours, Jackie Porter, who we would later say goodbye to last year. And it just seemed like such a moment in time that I'll remember because we were all together and because we were honoring such a great friend. And it was the last time that we were together. And so today I'm happy to welcome you to our virtual event. I'm thankful that vaccines continue to be a part of our lives that are becoming more widely available. And it feels like we're getting closer to that little light at the end of the tunnel. I think with a little bit of luck, a lot of us that are here today will be back to some kind of normalcy after this challenging year. And I think that we'll be together next year. But I think we all know that for many children and families here in Texas, they will continue to grapple with the challenges of the pandemic for years to come. So it's my privilege today to introduce to you some talented, passionate advocates who have dedicated their lives to serving Texans and Texas children and families. This panel of experts is going to help us understand the long-term challenges of the pandemic and how we can support the needs of families across Texas moving forward. First, I'd like to introduce to you Mr. Eric Hale. He is the 2021 Texas State Elementary Teacher of the Year and the state representative to the 2021 National Teacher of the Year Awards. He is the first African American to receive both honors in the history of Texas. He teaches at David G. Burnett Elementary School in Dallas and has been featured on the Today Show, the Kelly Clarkson Show, Access Hollywood, the Washington Post, and even held a TED Talk in Dallas prior to the pandemic. I'm thrilled because I actually saw him on the Today Show when it happened. Mr. Eric Hale, welcome.
Thank you. I'm glad to be here. Thank you so much for this opportunity to be a part of such a wonderful organization. And I hope I have something to share that will move the needle for progress in the state of Texas.
Appearing alongside him is Miss Elena Marks, President and CEO of the Episcopal Health Foundation, a $1.2 billion philanthropy based in Houston. She serves on the boards of Grantmakers in Health, the largest national organization serving the field of health philanthropy, the Harris Health System, an integrated health delivery system serving over 300,000 patients annually, and the Community Health Choice, a nonprofit community-based health insurance company with over 400,000 members. To say she's dedicated to health reform and access to care for low-income and uninsured populations is an absolute understatement. Miss Elena Marks, welcome.
Thank you so much for having me. I'm honored to be with you today.
Thank you, Elena. And finally, I'd like to introduce Miss Stephanie Rubin, the CEO of Texans Care for Children and a friend of mine. She has led the organization as it's grown, increased its public profile, expanded its research efforts, and worked with partners and state leaders to propose and pass numerous bills impacting millions of children here in Texas and their families. Stephanie, welcome.
Thank you. I'm happy to be here too, and I'm grateful to have my job every single day. So I appreciate everyone.
Thanks, Stephanie. So let's kick us off with this. Last year was such a challenge. So many things have changed. COVID has taken so many lives while continuing to challenge people, systems, and communities in so many ways. When you reflect on this past year, what is one change you've seen during the pandemic that you think we should keep moving forward?
Moving forward, we need to make sure that all families have reliable connectivity. That was something that was shockingly low for children in the DFW area. I think they had said something about like maybe 30 to 40% of children didn't have reliable access. So even when we gave them technology, they still didn't have what they needed to be able to attend school virtual. I'm a firm believer that now that we got these extra skills and tools, that we need to have those at hand in our little bag of tricks. So if anything else happens, we're able to transition much easier than we did this time. So I will always do some assignments virtually going forward, even when hopefully things return back to what is the new normal. So I'll teach my heart out in person and hopefully be blessed that all my children are in person. But then there will be times during the day where we'll do a quick write. We'll do a quick little assessment using technology so we don't lose those skills that we were forced to learn.
Great, thank you. Stephanie, what about you? How has that changed how you're currently supporting our families and children?
Well, I would kind of center my answer on the question of family and caregiver. I think we've all seen just personally and, in our communities and really the impact of the pandemic on how families have functioned, whether they've been able to get to work, whether they've been able to find childcare, whether they've been able to really support their kids at home, given all that they're balancing amidst loss, amidst trauma, amidst poverty. And so, we're talking a lot more about the needs, not just of kids, but of the family unit. And I think, in some ways, it's really important for us to communicate, all the things that an incredible teacher like Hale can do, all the things that an incredible philanthropist like Elena can do, all the things that the private sector can do. But there's such an important big role for government in supporting families and giving them the help they need to get kids off on a strong start when they're young, to help struggling parents. And I think, there's a shared vision there that we all really want Texas families to thrive. So the question is, how do all these pieces fit together? And that's what we've been focused a lot more on. And in addition, the disparities and equity piece, which is, who's suffering the most, who's the most likely to be uninsured, who's the most likely to not be in pre-K or, high quality childcare. These are all really, big issues that have to be addressed with an eye towards equity, or we're really not going to help the kids and families who need it most.
Thank you. Elena, just in terms of that, in terms of the work that you're doing in that role as a philanthropist, and how do you approach that work now? Because I'm sure it looks different to you than it did a year ago.
It really doesn't look different to us. Unlike Stephanie or Eric, you're actually doing the work. What we do is fund work. And so for us, our lives at the foundation didn't really change. We are extremely privileged. We could easily work from home. We had great technology. And when we realized this is a big thing and it's here to stay for a while, and we completely changed our grant making in 2020. But what we did was we understood that our goals and the way we fund is devoted to long-term system level change, and that was even more imperative, that the pandemic showed all of the gaps. Eric talked a little bit about how we prepared for the next time. Stephanie talked about the role of government, which philanthropy will never replace. We're this big compared to government. And so for us, we said we were going to stay the course. And what that meant for us was to provide additional grants to our same organizations, because we wanted them to make it through and be in shape and ready to pick up the work again when the time was ripe. And so that's really what we did. We have never funded direct human needs. It's just not because it's not really important, but we don't do food or rental assistance or anything like that. And so when a lot of philanthropy was being directed in that way during the pandemic for very good reason, we didn't, because we want to continue working toward long-term systemic change, and we wanted our partners in that work to make it through. And so I'm really grateful that there was such an outpouring from philanthropy for direct human needs, because I guess it allowed us to feel a little bit better about not jumping in that space, because until you can address the root causes, this stuff's just going to keep happening. And we have chosen to make our investments upstream and long-term and system oriented. And we didn't change that just because we were in a pandemic.
And you're actually kind of getting us to, and I mean, obviously we need the support of our stakeholders, our members of our legislature, and just community members being involved and really understanding the challenges that we're facing, not only with the pandemic, but just recently. I think everyone kind of remembers the winter storm, even though the sun's out now. It wasn't out just a few short weeks ago when we went through that storm, and we saw, I guess, the impact to families who were already in crisis, particularly families of color who'd been disproportionately impacted by COVID. Again, you had already mentioned, Eric, the lack of access to broadband and remote learning, and then also losing their health care. So I think this question obviously is for all of you, but what should be the top priority moving forward to ensure that our parents and children in Texas have what they need to thrive? You know, I know, Eric, education is first and foremost there, especially from the lens and the classroom in which you sit. But given all of those pieces together, what would be at the top of your wish list?
From a social emotional standpoint, it would be giving every member of the community more grace. And like what Miss Rubin said, a lot of the parents that I serve, they're the most vulnerable. And so I've helped a lot of my parents fill out applications to get new jobs. I've provided them resources where they can get good daycare, where they can go to a food bank and receive food when they need it. So stepping outside of normal roles, speaking from an educator, we have to do more. And we got to view the children and their families as part of our family. Because I'm a firm believer of the love that you put out there in the universe, it always comes back. And so this year I did a lot of focusing on helping them. So a lot of my children's parents this year lost their jobs. And so they were going to have the hardest Christmas that they were ever going to have. And so just to give you a little insight on what communities of color or communities living in generational poverty are going through, where I teach in the red light district of Dallas. It is the ghetto, the Hispanic ghetto. So in the last 3 years, this is what my families and my children that I serve have went through. One, there was the ICE raids. So that started about 4 years ago. So I've taught kids that literally were in cars where their uncles got deported, right? Then the next year, I work at the school that was hit by a category F3 tornado that decimated their local community, right? So then they lived through that. But our baseline is that they were already well below the poverty level. They were already well underserved when it came to even having health insurance. They were already behind the 8 ball because many of them, their parents aren't English speakers. So then what happened after the tornado that just happened last year? A couple of months later, we go into a global pandemic. that affects them even being able to work to put food on their families. So knowing all of that, there was no way I could not advocate and fight for my children. And so I took it upon myself to provide Christmas for every student that I served. I reached out to my community. My student teacher reached out to his community. And before we knew it, that culture of care, that community of care, it snowballed. And so each child in my classroom got 25 brand new Christmas presents. So we were able to provide Christmas not only for the children in our class, but for all of their siblings. Then we said, well, we know there's going to be food insecurities. What can we do? We reached out again. We were able to provide 2 meals a day for the whole winter break. So we were giving out cases of food, cases of green beans to help them with that. And so that's a circle of love, because my parents worked with me all summer long. We've been working a year round. So when it became the slide, we focused on the thrive. So those parents love their children so much, regardless of not having a job. They were out at the circular drive with me, with masks on, in the heart of a pandemic, picking up gently used technology that was given to me by Texas A&M Commerce, because I held them accountable for the success of our kids. So they gave me that. They were out there receiving reading and books and stuff. They were out there working every day with United to Learn. They provided tutors all summer long. And so there's no way that I could ask so much of the parents that I serve, knowing what they're going up against. Having my students write letters to Santa with them full knowing that they weren't going to receive anything because mom and dad haven't had a job for months. So I had to step outside the normal box of what an educator does and let them see the education of love from an emotional standpoint. We can still do that. And so we were able to ease the burden of Christmas, and the money that they would have tried to use for their children, they were able to save or buy more groceries or just get ahead on their bills. And so it's things like that that people are doing across the country, across DFW, and across our state. And so that's something that I, moving forward, will do more of as much as I can.
Well, Eric, those children and families are to have you in their lives. Like, you truly are a blessing, and we're so honored to have you on our panel and hear your story, knowing that there are others like yours. So thank you. Thank you for all you've done. Yes, thank you. Elena?
For the legislature, for me, it's coverage expansion, Medicaid expansion. I feel like we are closer than we have literally ever been, and that it is the single most important thing the legislature can do for the health of our families. And it won't solve all of our problems, but there is no substitute for Medicaid expansion that will allow access to health care for more than 1 million Texans who simply are otherwise going to remain uninsured. And that means they don't have access to health care in an adequate way, the way that probably all of us on this Zoom do. And so I think it's just really critical. Listening to Eric, you remind me how important empathy is and lived experience. And I don't believe that enough of the members of the legislature have enough connections, personal connections, to the kinds of students you serve, the kinds of families Stephanie serves. And that when you don't know that, when you aren't familiar with those people and their lives and what their issues are, you make stuff up and it's not accurate. we've seen so many instances where legislators who seemed completely disinterested in a particular topic, something will happen to a family member related to that topic, and all of a sudden they're filing all these bills on that. And I don't know how we better connect policymakers to the real lives of families in need, and get rid of these notions that, people aren't working hard and they're making poor choices and all that kind of stuff. And I know there are some bridges out of poverty and other kinds of trainings that try to share those experiences. But if you don't have those experiences or relationships or opportunities to really learn, I don't mean just go look at people, but actually engage. The next best substitute is empathy. And I think we have an empathy deficit in the state, and that the focus on what's this going to cost now dominates all conversations, and that it's dehumanizing and ultimately undermines the success of the state because we don't invest in people. And until we get that either direct experience, relationship, or a little more empathy, we're not going to be able to close the gaps, because the people who are elected most of them don't come from these backgrounds, and they just don't understand.
So one of the things I think as an opportunity is that, the more that that lawmakers hear and interact with people who can talk about their personal, stories and what's mattered, a great teacher, a supportive school, a community program that helped lift them out of poverty, the value of ECI for their kids with disabilities, hear from diverse voices. I think that's going to help. Diverse representation in the legislature would also help. And I know Elena would agree with me on that. But once we have an opportunity to meet in person, we need to get lawmakers out to visit programs, come look at an Eric Hale, classroom, find something in their own district where they'll also, be able to say, hey, here's something, here's one of my constituents, and look at what she's doing and what's mattered to her. I feel like one of our challenges is going to be, once we can interact in person with people, is to get lawmakers out of their houses, out of their offices, away from Zoom, and really see what's working, and what's not working. And I think better policy is likely to follow when we do that kind of in-person, have that kind of in-person interaction.
All right, guys, I want to close on a positive note. When you think about the future, what makes you feel hopeful?
That people do learn and change and grow, and that's a good thing. That generally things over time, to badly misquote Dr. King, move in the right direction. They just don't always move linearly or as fast as we'd like.
Thank you. And Eric, what about you?
I'm a firm believer that life is a beautiful struggle, and moving forward as a collective, we have an opportunity to show children that we serve and families that we serve that are vulnerable, that there's more beauty than struggle, and do the best we can to give everybody an opportunity to be a productive member of society. And so work hard to level the playing field so everybody has a choice and a chance to find their American dream.
Beautifully said. I couldn't agree with all of you more. And Stephanie, I'm going to give you the last word as the executive director and our CEO of Texans Care for Children. And such an honor again to be with all of you today, and to all of those that are here with us on Zoom, in your comfy office, or wherever you might be. And thank you for joining us. And Stephanie?
Well, I mean, first of all, I want to thank, everybody who works with us and supports us and teaches us, including the people on this call. And I want to thank my team, who's incredible, who's very dedicated and work, very, very hard day in and day out. And they're right in the thick of legislative session. And it's pretty chaotic, and it's, in an environment that's only semi-safe. And so I'm very proud of them. In terms of wishes, I would just say, to join Eric and Elena, that we have a huge opportunity. We are in a big state of Texas. We are in one of the biggest, global economies in the world. We have a huge amount of investment and money coming from the federal government through relief acts and rescue plans and infrastructure plans and other things. And we have an opportunity to maximize probably the biggest, funding infusion to Texas in a long time for our systems and our services, for schools, for healthcare, for early childhood, for childcare infrastructure, for all these things. And it's really up to all of us together to, make sure that Texas maximizes that funding and focuses on the kids and families who need it most, and on the effective programs based on data, and make sure that families get that, and it's equitable, and that those decisions aren't just made in back rooms, that they're listening to communities and they're listening to parents and talking to people, like Eric, what's going to help in your classroom with your young kiddos. So I'm really optimistic about what's coming up. You sort of have to be, when you're an advocate, a little bit optimistic, sort of a rational optimist. And I'm just grateful for the job I have and the people I get to work with. And I look forward to seeing everybody. That's really maybe even my biggest selfish wish.
Thank you, Stephanie. I want to thank everyone for joining us today, and all of our sponsors, everyone that continues to make this event possible. I look forward to seeing everyone in person. And Chris, I'm going to send it back to you.